When a baby's born, they come ready to relate and to interact and to be in relationship. And so babies are hardwired to seek healthy, positive, protective caregiving. And caregivers are hardwired to provide that. And this, we have neurobiological and hormonal changes that produce this. That's to support and develop a healthy, secure relationship. So we talk about what babies need to develop that, and they need someone that is responsive, that keeps them safe, that helps them develop self-regulation. So babies are born not being able to regulate their own temperature, their sleep patterns, when they eat, when they get changed. They learn that by being co-regulated by a responsive adult that responds when they cry, that feeds them when they're hungry, that changes them when they're wet. They develop what we call a working model, an internal template for how relationships, the expectations of relationships. When that goes awry, when caregiving is not protective, when it's not safe, when it's not secure, when it's neglectful, and when it's harmful, then that working model gets skewed, and all of the things that are important for babies and young children to develop, they're different sensitive times in the brain for development. When we learn language, when we learn speech, math, all of those, vision is developed. And if those aren't being utilized at that time, then we lose the capacity. So for language, babies are born with the capacity to make any kind of sound and learn any kind of language. Over time, if they don't hear and use certain sounds, they're not going to speak Japanese. They're going to speak English or Spanish or French. And it's much harder to learn it later on. I don't know if you've ever tried it. So learning things later on takes a lot longer. This is why we have early intervention programs, why we have Head Start, why there's been a lot of focus on early childhood education and care. When those things go awry, when we have neglectful or harmful caregiving, that impacts young children in a different way, because it impacts their brain development, and it impacts the structure that's the foundation for all later learning. And it also impacts what they're learning at that time. So children need healthy relationships to survive. There have been a lot of studies that without a relationship, even if they're cared for and fed, they fail to thrive and sometimes even die.